Hi, everyone. We're now going to dive into the challenges of training and supporting customers in this new environment where things largely happen online. As you know, Tandem recently launched the second ever commercial AID system, and we've had quite an interesting journey bringing this to patients. I'm excited to share this with you here at D-Data and discuss some of our key lessons learned. So let's review Tandem's automated insulin delivery system. Our system, Control-IQ technology, is an advanced hybrid closed-loop system. And the reason why we use the term advanced is because our system has the ability, in addition to modulating basal rates, to deliver automatic correction boluses up to 1 an hour as needed. The system is designed to help keep users in the recommended ADA targeted glucose range of 70 to 180 milligrams per deciliter. It does this by automatically adjusting insulin delivery every 5 minutes based on a 30-minute predicted CGM value. Control-IQ was not Tandem's first algorithm-embedded system. Our company launched a predictive low glucose suspend system, Basal-IQ, in 2018, which turned insulin on and off based on predicted CGM values. We like to use the analogy that Basal-IQ was like a light switch, turning insulin on and off, and Control-IQ is like a dimmer switch, slowly modulating basal up and decreasing basal as needed. Although many people have the misconception that Control-IQ is just Basal-IQ with protection on the high end, this isn't really the case. Control-IQ is completely different than Basal-IQ. It's an algorithm that was licensed from Type 0 Technologies, which is a spinout of the University of Virginia, and embedded onto the t:slim X2 insulin pump. It has very different rules and behaviors than the Basal-IQ algorithm. Going into this product launch, we knew that it was going to be paramount to educate healthcare providers and users on the differences between these two systems and the algorithms and how they behaved. Components of the Tandem Control-IQ system is the t:slim X2 insulin pump, the Control-IQ embedded algorithm, and the Dexcom G6 CGM, which is the CGM that is used to make those predicted sensor glucose values. So historically, when an insulin pump company would launch a new technology, such as Control-IQ, there were a very distinct set of steps that one would need to go through in order to procure and get access to the technology. So an individual would visit their doctor or the healthcare provider team. The two individuals would decide that they wanted to move forward with insulin pump therapy, so a doctor would write a prescription. Then the person would get in contact with either the device manufacturer or their distributor to purchase the device. And then the individual would be trained by a qualified or certified trainer who could assess comprehension, answer questions, and provide any guidance on the system. Whenever you have these series of defined steps, there was a natural gating process that happens because any one of these individual steps could take days or potentially weeks. And ultimately, once you launch a product, the users come in over time. And so there's sort of a natural staggering that takes place. However, as many of you probably know, one of the unique characteristics of the Tandem pump is that it is a software updatable platform. So our users who already had a t:slim X2 insulin pump, some of them may have been using Basal-IQ technology, or they may have just been using a CGM-enabled pump. They now have access to this software simply by updating their pump. And so that means that that natural gating process that I described in the prior slide doesn't happen to help stagger adoption. And so let me show you exactly why. So in our case, users really have the ability to decide when they want to adopt the technology. So here's a really high-level overview of how a user would remotely update the software on their pump. So again, you have all these existing people out there that have a device that's eligible for a software update, and they can go ahead and start the process anytime they want. So as soon as Tandem makes the software available to users, they can go online to the customer portal and begin the update process. So you see here, starting on the left-hand side of your screen, a user receives an email from Tandem letting them know that the software is available and they can go ahead and update their pump. They request a prescription from their healthcare provider. Once Tandem receives the prescription, a user is assigned online training. This could be a single module or it could be a series of modules that they can complete. They are then required to take a quiz to assess comprehension. And once they pass the quiz, they are sent a unique code to update their pump. So Tandem attempted by the initial email outreach to stagger adoption by limiting the number of emails we sent out in a given time. But as you can imagine, once one person finds out about it, then they tell people, and then the next person tells people, and pretty soon the email is irrelevant and people just know to go to the customer portal to start the process. And because we had so many existing users already on the system, there were thousands and thousands of people eagerly waiting for the technology and wanted to be the first to get it. And so the pent-up demand was really quite overwhelming for our entire organization. Unfortunately, I think we were all a bit naive in thinking we could control the demand. And within 24 hours, we realized our mistake, as we only had one way for people to get answers to all of their questions, and that was to call our customer support group. And even with the best planning, I think it's difficult to predict how much interest you might see in a given enhancement, and extremely difficult to scale for, because you know you're going to have this big tidal wave in the beginning and then it'll taper off over time. And unfortunately, at launch, we were suffering from hours of wait times. Several hundred people were in the queue at any one given time. You can appreciate how frustrating this would be for everyone involved. Our customer service agents were working overtime and absolutely exhausted, and our current as well as new customers were extremely frustrated with the long hold times. We realized immediately that we had to pivot and utilize other tools to be able to drive people away from the phone lines. One of the first things we did was analyze the kind of calls we were getting into our call center. We learned that roughly 20% or a fifth of the calls were education-based inquiries. And so we met as a group to figure out how we could quickly address these items. One of the areas of opportunity was on our website, specifically on the help section of our website. We had a fairly static area of the resource and support section of our website as far as how the information was displayed. You can see here, it's not very user-friendly. It's just a laundry list of items that you can click on if it's the information that you need. And of course, we had documents like user guides and instructions for use, but generally people don't sit down to skim through a 400-page user guide if they just have a simple question that they want to get an answer to. Fortunately for us, we were already working on revising the support section of our website and how users get help. And so that first week, we implemented dynamic search capability to help address the high volume education requests. So this allows users to type in keywords that they're interested in. So for example, control IQ. And then when you click search, it immediately sends the return of relevant content. The new tool also gave us the ability to tag and star items that we knew people would be interested in to help it rank higher on the list of results that were returned and displayed. You'll see here, we tried to bucket things into categories, the top categories. So for example, the t:slim X2 insulin pump. And then as I mentioned, we starred specific articles that we thought people would be most interested in. Even now, months after launch, we review the search terms that people are searching for and look to adjust the content appropriately. This new support section has received great reviews from our users and also our technical support agents. When we launched, we also had several people call in to ask how to start a software update process. We opted at launch not to have a button on our home page that led people to the customer portal to start the process because we thought we could help control the adoption, but ultimately that backfired for us. People didn't want to wait till Tandem emailed them. They wanted to be in control and to go start the process when they wanted to. And so we realized we needed to add this button to the home page very quickly. We did so, and this drastically reduced the number of calls that we were receiving for people asking a simple question of, how do I begin the software update process for our pump? We also relied heavily on our social media channels to be able to spread the word. It is a fast and inexpensive way to reach the masses since we're all so interconnected online these days. We used the platforms like Facebook, Instagram, Twitter, YouTube for educational discussions around things like how to update the software on your pump, or education around some of the Control-IQ specific functions like sleep and exercise activity. And these platforms really gave us a way to connect with our users and help disseminate the information so that people wouldn't pick up the phones and call. Not only could we reach people through our channels, but because people like and reshare and repost content, we could reach a much broader audience than just the people that directly followed Tandem. And here's an example of why I think it's really important that organizations consider diversification within their support tools. I'm going to read this post from a user that we got into our Tandem channel. Got this sweet new pump. No idea how to use it. Guess I'll start watching YouTube. That's how you learn, right? In no way am I endorsing YouTube as a way to learn how to operate an insulin pump, and people still need to go through the formal in-person training with a qualified trainer. But the purpose of me showing this is simply to illustrate that people seek a variety of outlets to get their information, and it's definitely not a one-size-fits-all. We did develop a series of short and punchy educational videos on how Control-IQ works, how to use the sleep and exercise activities, and how to turn the system on. We know that in today's modern world, people don't have a lot of extra time to sit down and read a long user manual. So we created these videos to be short and engaging and visual for our users. We have them on our YouTube channel, and we continually refresh the content there to give people some best practice tips and tricks on how to use the system. A few of the other ways we work to engage our audience, we took advantage of the fact that people were calling in on our phone lines and developed a series of one-line informative recordings that would loop as people waited on hold. Things like where to go to begin the update process, where to find help and support materials, and directing them to our YouTube channel for educational videos. We developed an email campaign series with short 60 to 90-second informative tech tip videos that highlight a different feature of the pump. And they're just meant to be bite-sized bits of information that people can watch at their leisure. And lastly, we utilize platforms like Facebook Live and webinars to engage our audience and answer real-time questions that people might have. And like everything, we continue to evolve and look for areas of opportunity to improve the customer experience. And so to wrap up, some of our lessons learned, again, diversify the support tools because one size is definitely doesn't fit all. We know that user experience matters. Making things quick and easy to navigate is paramount for success. Word travels fast in the day and age of social media and interconnection, and try and use that to your advantage. That's what we try and do every day. And never underestimate the power of the diabetes community. They are often online, they are a vocal community, they help one another, and so to the extent that you can leverage that, we want to do so. So I appreciate your time and attention, and I look forward to taking your questions.